Hello, Bassam, Basma, and Abdul Karim. It's nice to see you. I will have to mute all everyone. So,
الله بالخير.
Alan. Nice to see you, Faris.
Nice to meet you again.
Okay. So I guess I will mute everyone so that if there is like some noise or anything, and then we start. So nice to see you. Thank you so much for joining me now. It's 5 p.m. here, and I'm sure like not everyone is I mean, in terms of time, this is not the best time for all of you. But thank you so much for trying to be with me, and I hope we could provide a good session today. It will be about monitoring, evaluation, accountability, and learning, and how we think about it and how we include it as a paragraph in proposals. Usually donors are asking about monitoring and evaluation, and it's a very important part within the proposal. And it like usually the donors are there is always a paragraph of monitoring and evaluation in the proposals, whomever the donor is, whether USAID, UK Aid, Swedish international development agencies, in UN agencies, or whomever, all of them are asking for a paragraph of monitoring and evaluation. But there is a lot of thinking around it, because now what we are going to talk about is the thinking around monitoring and evaluation from the perspective of writing the proposal, I mean, we will not go on details regarding the implementation. So it's, yes, this session is a monitoring and evaluation session, but it's limited to the part related to the proposal. And I'm sure we will go on details on the next sessions. We will talk a lot how to implement, what kind of documents, like a lot of specifications regarding monitoring and evaluation, accountability, and learning. So I will share the presentation, and let's start. Today is the session number 9, and it's session number 9, but it's the 5th session of the proposal writing. So I hope it could add what is missing regarding this topic. And I will start with the session 8 objectives. By the end of the session, we expect that every participant should be able to develop the M&E part of the proposals, differentiate between monitoring and evaluation, and also how meal activities are linked to indicators and verification methods, how to avoid unimportant and difficult to-do meal commitments. Usually, when we write proposals, we feel very excited, so we put very difficult monitoring and evaluation activities, especially things related to evaluation reports. So we will talk about them and how to avoid that. In the proposal, we have many parts, and now we are at this level. So we have already like achieved many parts. Maybe we didn't talk enough about activities and work plan. We will try to go back to it. But in general, now we are on monitoring, evaluation, accountability, and learning. It's meal. Sometimes it's called Q meal, because they add quality. Some these just say meal, some these just say M&E. So the very famous known of this is M&E, which is the abbreviation of monitoring and evaluation. So quality of programs. You will always listen to like people talking about quality and the quality of programs. And I wish you could consider this. It's the monitoring and evaluation never goes to operation and HR. I mean, sometimes it goes to HR, but usually for HR, for procurement and finance, logistics, all these are not very much related to monitoring and evaluation. These are part of the internal compliance of the NGO. But the programs compliance, the compliance of programs, the quality of programs is what is called monitoring, evaluation, accountability, and learning, because these four parts are actually the quality. And I will start with monitoring against evaluation and what is the difference between both monitoring and evaluation. Of course, you can read a lot about them, and maybe I will add just two important points. So, for example, for sure, monitoring is usually continuous. So usually we do monitoring every day. We follow up with activities. We do many things on everyday basis, every week and every month. So it's like from the beginning of or the first day of the project till the last day, and sometimes even after, like doing monitoring of project activities and trying to make sure that they are going on the quality or the required quality. You notice here that evaluation is periodic. So usually when we do evaluation, we don't do it on even weekly basis. We don't do it on weekly basis, except at the first few weeks of project implementation. But usually evaluation is done monthly. So usually when you have a monthly report, it's a kind of evaluation of the progress, what has been like implemented in terms of activities, what has been achieved in terms of indicators and targets, or to what extent the project budget is spent. So evaluation could be monthly. Usually it's like midterm and annual. It could even start before the project when we do the needs assessment, and it's done sometimes at the end of the project when we do a project final review or when we do the end line survey. So it's periodic. For monitoring, it's usually done internally. So it's internal by the NGO own staff or the project staff. The project manager, programs managers, the executive director, the country director, or whomever could do internal monitoring for the project activities, including the monitoring and evaluation staff. So it's done internally, but for evaluation, it's usually done externally by third-party consultants, whether they are individuals or they are companies or firms, consultancy firms. And usually they are hired by the NGO itself, and sometimes the donors send you their own third-party consultants. So, I mean, when I say their own, it's like consultants or firms that are hired by the donor themselves. But also the NGO could hire external consultant who comes and give their opinion on the project implementation, quality, and progress. The monitoring has very easy tools. So for example, you have an Excel sheet, you put like timeline, and every week you collect number of beneficiaries. Sometimes you have templates for reports, you collect data and document it, you collect pictures, you collect names of participants in the training or events. So it's like you are collecting things in a very easy way. But for evaluation, you collect data. It's like complicated tools. So it's like research, data collection and analysis. It's a little bit complicated. That's why usually not all monitoring and evaluation staff are able to do evaluations. And also sometimes all NGO staff do not have the capacity to do it. So for example, when we see monitoring, usually all NGO or most of NGO staff are able to do monitoring, but for evaluation usually is the most difficult part, and usually only like experts, those who has like extensive experience on research, data analysis, or those who has attended with external consultants and learned from them so that they are able to do project evaluations. The monitoring is usually done for collection of data, and the data for indicators starting with hash, with number. So this is representing number, as we mentioned on the logical framework part or session. We mentioned that indicators, the quantitative indicators should start with number, or percent. So now, I mean, indicators starting with number needs monitoring activities to do, like to collect the data that confirms as an evidence that it has been implemented. While for the indicators starting with percentage, they need evaluation activities to confirm that it has really done or that it has really achieved. We will talk more so that we clarify about it. Why the monitoring and evaluation? This is a very important question that we need to ask ourselves. Why do we need to do it? And the answer is because we need to do it for accountability and learning. And for sure, it's for quality. So for quality, accountability, and learning. Uh, some NGOs and United Nations agency, for example, if you go try to Google meal, like MEAL, you will notice that they say meal is monitoring it and evaluation for accountability and learning. They have a department, or they have like a program within their own structure. It's called monitoring and evaluation for accountability and learning, and this is actually answering why we do monitoring and evaluation, to ensure we are accountable to our beneficiaries and also accountable to our donors and stakeholders. At the same time, we are doing it for learning. Not only we learn like alone, but also our donors need to learn. Our stakeholders, government, other agencies, local authorities all of them need to learn. That's why we do monitoring and evaluation. At the proposal stage, and this is what we are talking about today. The M&E paragraph in the proposal is included in proposals because the donors need to know that you understand the basics of project management and reporting. So at the proposal stage, it's like we try to show that we understand project management, that we understand reporting, because this is a very big nightmare for donors, because sometimes they give the money even if it's like few budget, even if the project is like has a small budget, still the donor needs to document the achievements. So the donor is also accountable against the government, against their own sponsors or donors, or like taxpayers, or whomever is paying for them. So they need to report what has been achieved and how the money is spent, who are the beneficiaries, and how many they are. So when the agency is not able to provide reports or good quality reports, the donor feel like this is a big a mistake working with this NGO. So what are the basics of project management and reporting? Usually the expected basics in terms of monitoring and reporting and project management is the implementation plans. So the NGO implementing the projects need to show the donor that they can do the activity plans, they can prepare the monitoring, evaluation, accountability, and learning plans. Sometimes we call them M&E plans. Also the spending plans. There are procurement plans, there are HR plans, there are, sometimes they call it a spending plan or whatsoever. But at like let's say that all the plans are shortened, or they could be included in the 3 plans: the activity plans, meal plans, and spending plans. All NGOs need to know and understand and learn how to do it. And also project managers, programs managers, directors, all of them, they should be having the capacity to do these 3 plans. And that's why you need to show the donor when you write the paragraphs that you know about it. And also you need to talk about monthly tracking. I know how to track activities, how to do indicators tracking, how to do spending tracking. This is very helpful and important, because usually like what you do in project management is you are managing 3 things. You are managing people, you are managing time, and you are managing money. So if you are not managing the 3 things at the same time, you will lose time and you will not be able to implement. And then if you implement in a very short time, if you had to accelerate the process of implementation, this is making the project like not able to be done in a good quality, and also It could affect the number of beneficiaries. You could not spend the money in the right time and in the right way. This might lead to a lot of difficulties and a lot of mismanagement. So you need to show the donor that you can do monthly tracking. The evidence collection. You need, this is really important, and it's one of the most important tasks for monitoring and evaluation people. They need to collect evidence of implementation. So they need to collect activity reports, but also the annexes of the activity reports, because these are really important. Activity reports, for example, you are doing a training report. The training reports need you to include the pictures for the banners, the attendance sheets with the names of attendance or attendance participants signing that they have participated. Also, you need to document the training materials, the CV of the trainer, pictures for the training, assessment of the training, the opinion of the participants, how did they find the materials and the trainer. So a lot of things are collected as part of the activity reports. Also, you are doing this during the field visits, during the collection of data of the targeted beneficiaries. You could collect vouchers and procurement documents as part of an evidence that this project is done and that the money is spent. So this is like evidence collection needs to be like, you need to assure the donor that you know that you will collect these evidence and that you will report them in a good way and in a good quality. Reporting of achievements is also the most important part, and it's actually the result of doing all the monitoring. We do a lot of monitoring just to include and prepare good reports, and the achievement reports, like usually you need to show the capacity to do the monthly reports, and maybe like many donors, they need you to share the monthly reports with them. Some donors, they put it as a schedule. Usually, like most of the donors, they schedule the reporting times. So they mention that it could be monthly. Sometimes they ask you for weekly reporting at the beginning of the project, but like the usual reporting schedule for donors are the quarterly reports, the midterm, like the mid-time of the project. If the project is for more than 1 year, then there is what is called annual report and final report of the project. These are really important basics of project management and reporting, and usually the donors need you to understand. They need you to be able to do them in a good quality, so they feel satisfied and continue working with you. A question that could come to our mind is that how to decide the best meal activities. What are the best monitoring, evaluation, accountability, and learning activities to include in the proposal? This is another question, because usually you could like search online, you could read many books, many guidelines talking about monitoring and evaluation activities, but you will have a difficulty how to decide what is the best activity to include in the paragraph, so that you don't raise the expectation of the donor, and also the third-party consultants, when they come to do the assessment and when they come to see how did you implement the project, they will ask you to provide an evidence for everything you mentioned in the monitoring and evaluation part. So the good way to do it is that you need to review indicators. So you go to the logical framework and you see the indicators, the verification methods in the logical framework, then you decide the type of meal activity. After you decide it, you include this activity as part of the meal paragraph of the proposal, and I will give you 2 examples. I hope that they will be good enough, and hopefully that it could respond to like many questions that you may have at this level. So the first example, it will be for an indicator starting with number. This hash is like a number, as we mentioned. So any indicator starting with number need monitoring and accountability activities. I would show you, for example, now, as we mentioned also, the indicator has three parts. When we see an indicator and when you hear the indicator, you need to think about three parts. The indicator has like the paragraph, like the phrase of the indicator. So this one, the sentence of the indicator, the question. Then the answer, which is the target, how many, like for example, how many, what is the number of beneficiaries or people benefited of medical services. Then the answer will be 52 800,000 people. You would find that this is the same indicator we used in the last session. So they are divided by men, women, boys, and girls. So this is the answer, and also the verification methods are still part of the indicator. So this is the document that we will provide the donor at the end of the project, which has the evidence that this number has been achieved. It's like at this level, it will be monthly for this indicator, number of beneficiaries. The evidence will be the monthly statistical reports that we will collect during the lifetime of the project. So let's see that we go to the logical framework and we found this indicator. Then how to decide the monitoring and accountability activities. In order to collect the monthly statistical reports and to ensure that these numbers are true and they are correct and they are not fake, we need to collect beneficiaries statistics on weekly and monthly basis. So this is a monitoring activity. Also, we will have to do a regular, maybe monthly or regular field activities, whether monthly, weekly, every 2 months, every 3 months. It depends on the budget, depends on the type of the project and the security and many factors. But the more field visits you do, the best it is, because this will help to ensure the quality of services provided. And this is also a monitoring activity. When you do the field visits, you will also help to establish complaints and feedback mechanism, because you need to make sure that there are people who complain about the benefit, like the services. This provides like additional evidence that there are actual or true people, real people that receive the services. So when you establish a complaints and feedback mechanism, it's an accountability activity, but also it's an evidence, and that helps to verify that these people are really receiving the services and that these numbers are actually true numbers. Also, you will document the lessons learned. You could document the lessons learned and prepare success stories. When you go to the field visit, you select usually you select individual beneficiaries, or sometimes you select a family that benefited from the medical services, and then you document their story. How did they suffer, and how the project responded to their medical needs, and how this improves their lives, how it saves their lives. So documenting these lessons learned or prepare success or the success stories, it's a kind of learning activity, but it's still part of the field visits. When you do the field visits, you could do and document these things, and this helps. It becomes like part of the learning activities. Another example is for indicators, starting with a percentage, and all need evaluation and learning activities. So for example, I give you here the percent of beneficiaries satisfied of medical services received. And here the answer, we do not usually report like how many men, women, boys, and girls, but usually because the answer is what is the percentage, then the answer will be 80%. That's how it is. And usually, what is the best evidence? Maybe we could do a beneficiary satisfaction report. This is one of the evidence we could do. Maybe we could do a final evaluation of the project. It could be a final review of the project, post-distribution monitoring. We could do maybe midterm review of the project. So any type of verification method that is an evaluation type of activity could collect the answer of like how many beneficiaries. In order for this to be done, we will have to implement evaluation and learning activities, as you see here. For example, we will need to prepare a term of reference, TOR. It stands for terms of reference, and looking for individual consultants, and then you hire an external consultant that do this beneficiary satisfaction report or survey. Then you prepare questionnaire, maybe the consultant and you are helping them. The consultants prepare the questionnaire and then the data collection tools, select the representative sample of beneficiaries, then conducting the interviews and focus group discussions. So we collect the data, then we draft the final evaluation or the beneficiary satisfaction report. We do the recommendations and lessons learned as part of this report, so it will be a learning activity too. That's how we include these information as part of the M&A paragraph in the proposal. So we include these types of activities as like the previous example. We will include these activities as part of the meal or M&A paragraph. Now we will go to monitoring, evaluation, accountability, and learning in more details. I will try to make this session as short as possible, unless you have many questions. So in terms of monitoring, usually you will need to do office activities and field activities. The office activities will be, for example, preparing the meal plan, monitoring, evaluation, accountability, and learning plan, and then you will have to provide project staff with report templates that they should fill them after compiling like the project or the activities data during the implementation. You will need to do activity tracking, follow up with the staff on progress, and if there are like delayed activities, you need to push for accelerating the implementation and so on. You will need to collect data of assisted beneficiaries on maybe you could collect it by email from the project field staff, you from sometimes from let's say community committees or from service providers at the level of health facilities, schools, or whatever type of activities. So you could collect the data by email, by phone. You could also go to the field and collect the data. But also when you are in the office, you could also collect the data. You need to review every activity reports. You need to review the evidence, the annexes, the evidences of each activity, and then you document and archive these reports. And you could archive the reports whether like in hard copies, you print, you document in a good way, and then you put on a file, or you could also have a soft copies of the project reports, and also you document it in a separate folder and you share it, and maybe you put it in your server, you put it on software like Portal365 or wherever. So you need to review the report and make sure that it's final and that it has all the information needed and documented everything related to the activity and archived. While in the field, you will need to do, for example, field visits, as we mentioned, regularly, maybe weekly, monthly, bi-monthly, quarterly, semi-annual, or annually. You need to attend some different events during the implementation to make sure that they are done, that they are achieving the intended objectives of the activities. The quality is good. During these events, you meet with beneficiaries or participants, you collect their opinions. What did they say about the activity? What did they say about the services? Are the services good? And so on. Also, you need to meet with stakeholders. For example, you would meet with Ministry of Health, with education staff, with the health staff related, like governmental staff. You could also meet other staff of NGOs. You could meet some key informants, for example, the leaders and like at the community level, religious leaders, community leaders, tribal leaders, whomever is an influencer at the field level. You need to meet sometimes. You take their opinion and you consider it, and you report it as part of the field visit reports and as part of the project activity reports. Also, you could collect pictures, evidence of good implementations, and so on. So these are the type of monitoring activities. Of course, there are many monitoring activities. What we try to include here are the most important and like the activities that are usually practiced by NGOs, whether they are national, international, or UN agencies. While for evaluation, usually you need to make sure that the evaluation activity is done internally and externally. So it like part or some evaluation activities are also done by monitoring, evaluation, accountability, and learning staff, also by NGO staff, and external by the consultants. So for example, you would see that they are like connected activities. For example, you need to prepare the evaluation terms of reference at the TOR, and then when you have it, you will have to like search for, you send it to different consultancy firms or freelancers like consultants, and then you review the proposals submitted by these consultants and then select the best one and hire the best consultant. So after that, the best consultant will start to do a desk review of the project documents. After the desk review, the consultant will prepare inception report, including methodology, the samples of and the data collection tools. It will be sent then the MEAL staff, the MEAL officers, advisors, or NGO staff or project manager for review and approve. Also they need to review the inception report. You need to make sure that the data collection tools and of the evaluations and the samples are representative. The data collection tool is going to collect the required data to answer the question starting with a percentage. This is really important, and this is a very critical point of the M&E staff. You need to make sure that the data collection tool is going to collect the exact data and that it will provide you at the end with the answer of the question starting with the percentage. Then after the review of these data, you will need to send your comments to the external consultant to review and edit the data, the samples or methodology according to the comments. After it's done, then the MEAL staff, the project staff will need to coordinate with for the consultant in the field during the data collection. And so during the coordination, you might sometimes go with them and try to avoid bias by not attending some interviews, focus group discussions, or key informant interviews. So the data collected will be documented without any bias. But also you need to coordinate for every step, for every place the consultant is going to visit. So the consultant will be able to collect the data and conduct the interviews with key informants and beneficiaries. After this is done, the consultant will start preparing the first draft report of the evaluation report and will be sent for revision by MEAL staff and NGO staff. Then they will send their comments. So the external consultant will respond to project staff and review, submit the final draft. Also, it will be going for approve of the final copy of evaluation and then share this final evaluation, including the recommendations to the project staff, to the NGO staff. So like a framework will be like the NGO need to respond by a written document, ensuring that every recommendation is like accepted or not accepted, and what will they do to like for the accepted recommendation, and what are the next steps and how to include it in their future programming. And this is actually the part of learning, and that's why evaluation is done, is to learn and to improve the next time, whether during this project or in the future projects. Um, for the accountability part, usually there are many type of accountability measures or accountability activities to. There is what is called accountability to affected population. So it's AAP. Sometimes it's used by many agencies, for example, UNHCR. They call it. They call this like the accountability to affected population. So in terms of accountability, there are many activities, but I will talk about the most important part, which is usually assessed and asked for by the external consultants. And this is usually important, which is to establish a complaints and feedback mechanism. And this complaints and feedback mechanisms, you need to be responding to the type of the activities. For example, if the activities are health, if they are in remote areas, if they are in difficult to reach areas, you need to have a complaint and feedback mechanism designed in the best way where beneficiaries will be able to use, and also you will need to find a way to send the feedback. So the complaints need to have a feedback. After this establishment, deciding the best way, for example, by phone, by having boxes like complaints box, or by WhatsApp group, by chatbots within your website, by however, like through the community committees or so on. So usually after you establish it and decide about it, you need to inform beneficiaries about it. So you need to find the best way to tell beneficiaries how to send their complaints, questions, or whenever they have something they need to say or talk about regarding if they need to report a breach, if they need to report a problem, whatever. So how do you inform beneficiaries? You might put their like you need to have a dedicated number for complaints, maybe like a mobile number. You print it with the beneficiary cards. You could print it this mobile number within the banners of the project. So you need to state that if you have any questions, if you have any complaint, please contact us through this number. So you could print it on the prescription that you will give the people during receiving medical services or so on. So you inform the beneficiaries, then you receive the complaints, and receiving the complaints needs to be done on daily basis. So you need to receive the complaints on daily basis. As we mentioned, you need to have a dedicated mobile number. You need to have someone who has this mobile number answering the complaints, document the complaints, document the name, the mobile number, and so on. Then trying to get the right answer from the project staff, or if it's easy, or if they know the answer, they can answer at that time. So the feedback needs to reach the beneficiary at the same time. At the same time or even later, but it needs to be given or sent to the one who complained. So you need to do the follow-up with the team about it. Then you send the feedback with the beneficiaries, and then you document the complaints and feedback, and you report it as part of the monthly reports. You could have an Excel sheet. You document like beneficiary, where it and how you received it, how and then what kind of feedback did you send, and like if there are like any action that happened after that, you need to also document it. And this is really important part of the monitoring, evaluation, accountability, and learning work. So the monitoring and evaluation staff needs to implement this at all projects, whether it's like a short projects or long-term projects. You need to have it as part of the implementation. The last thing of the meal is the learning. So the learning, you need to do documentation and sharing. So you need to document and share. What are you going to document? You need to document recommendations that were given by beneficiaries, recommendations by external consultants, recommendation by project staff, project managers, NGO directors, stakeholders, whomever send you a recommendation, you need to document it. Like on a recommendation report, you need to document it at each separated activity. These recommendations are usually shared with NGO staff for internal actions and improvements. There will be like internal actions and improvement for the same activities, for the same projects, or for coming or future projects. Could be shared by, or it could be shared to stakeholders and donors. Also, we document success stories and humanitarian stories. And these success and humanitarian stories could be shared through websites. So you need to add them in your website. You need to include them or share them in social medias as written stories with pictures, or it could be like as an articles. They could be shared as videos. You could document it as a video. Like it's like the way you think it would be easy to do and also applicable way. The best is to share it with. You could share it with newspapers. It could be like international media, regional or national media. Could be. It, I mean, why do we do it? We do it also for promotion for the NGO, for the promotion of the project and donor, also for advocating and call to action, especially when we talk about humanitarian stories. For example, if there is a malnutrition, if there is a nutrition crisis or problem in certain village or district or areas, then humanitarian stories needs to be documented and shared with all media. So this is going to help everybody to respond, and like international, national, and even communities will start to respond as fast as possible. So this is really important part of the meal activities. You need to document also the lessons learned for each activity, for anything regarding like the project, whatever you have learned, and you need to share it with donors, stakeholders to consider in future work. So there are a lot of examples you need to do, a lot of lessons, like for selecting the beneficiaries, for the targeted area, for the type of implementation, for things related to like the weather, the timing, the like maybe the type or the cost spent for certain activities. So you need to document a lot of lessons learned. And this is the final part of monitoring, evaluation, accountability, and learning. It's actually a long name and you feel bored repeating it, but still we need to repeat it at this session. Hopefully I could add, as I mentioned, something to your knowledge. But now we need to know what to avoid. When you write a paragraph of monitoring, evaluation, accountability, and learning paragraph, you need to avoid to talk, like for example, in general, not only when you write the paragraph, but when you develop the proposal, you need to avoid the percentage indicators. Don't put in percentage indicators in the logical framework or in the monitoring and evaluation paragraph, only if donor insisted. If they didn't insist, if they just neglected, so it would be really good. So don't put indicators starting with percentage. Or qualitative indicators. Don't put qualitative indicators. Try to include indicators with like starting with number. Why? Because if you put percentage indicators, you will need to have verification methods of evaluation type, and this need external consultants. This is really difficult to implement. It needs additional budget. You will need to spend like thousands of dollars just for conducting this activity. Like collecting the verification method of evaluation type is usually taking many time. Sometimes it's difficult to find a good consultant. Sometimes it's difficult to implement if the project is short. and if the area is not stable in terms of security situation. So avoid it as much as possible. But if the donor insisted to include a percentage indicator, then you need to add the verification method of evaluation type. For example, you could talk about that you will do a need assessment. You could add a baseline. You could add PDM, which is post distribution monitoring. You could implement beneficiary satisfaction survey, midterm review, final review of the project, or inline reports. But you need to consider, don't put all of them in the same project. You could only do midterm review, or maybe you could just do final review of the project. For example, if you are going to do a final review of the project, then you don't do beneficiary satisfaction review, don't do baseline, don't do PDM, don't do inline. You just need final review of the project. If you are going to do inline, it will be enough. Then you don't need all other evaluation activities. So don't put more than one evaluation activity because it's difficult to implement. It takes time, it needs budget, it needs a lot of details. So avoid it as much as possible. But if the project is like for 2 years, for 3 years, the donor will prefer to do evaluations. If it's a development project, it would be good. But if it's humanitarian project, it would be much better to not include evaluation report or evaluation activity. Another question is, when do we need to include? Usually, that according to like OECD, which is Organization for Economic Cooperation and Development, there is the OECD decided that this was like on 1990 as a best development and humanitarian practice, is that any project that has a budget or a total budget of more than $1 million need a final evaluation report. So you need a final evaluation report by external consultant or a consulting firm if the project has a budget more than $1 million. If it's less, it would be much better to avoid evaluation activities and avoid a percentage indicators. And if you had to do an evaluation report, then you need to remember to add a budget line. So avoid forgetting to add budget lines. You need to add a budget line that has a budget for field visits and also costs of external consultants for evaluation activities. If the donor insisted to include evaluation, then go to the project budget, add a budget item for conducting final evaluation of the project. Then you need to add maybe like $3,000, $5,000, $8,000, $10,000. If the project is big, then you need much bigger budget for conducting this activity. I hope this is important to you and that you take it into considerations in your future programming and in your future proposal writing. I tried here to have a small paragraph that I used on 2018. I was developing a proposal for one NGO on 2018, and then I included this paragraph to the donor. And I still remember that it took at least like 10 minutes from me to do it, draft it, review it. And the donor didn't have any question regarding to it. So it was really good. It was more than enough. So for example, here I mentioned that we will conduct post-distribution monitoring report, and this is an evaluation report. So if you could avoid it, it would be much better, but this project was big. So I added to the proposal, and it was implemented by this NGO. But if you want to go through it, so just to make sure that everything included in this paragraph is something that we already talked about during this session. So for example, I said for ensuring quality implementation and appropriate monitoring of the project activities, our NGO will recruit a full-time monitoring and evaluation staff. A meal plan will be developed, and the detailed indicators with relevant meal activities will be conducted for ensuring quality implementation. So the following will be conducted: review the project implementation plan, develop detailed project monitoring and evaluation plan, review the NGO reporting mechanism, approve all type of templates of reports, staff and partners orientation on required reporting templates, conduct close follow-up before, during, and after activity implementation for ensuring quality, conduct field visits to project locations, ensure meetings with direct beneficiary stakeholders for activation of effective complaints and feedback mechanism, monthly activity and indicators tracking, review results with the project and NGO leadership, make necessary steps needed to accelerate the implementation or improve the quality of work, produce and develop a high quality reports, and ensure that they are reflecting the achievements as per the project outputs and outcomes, and conduct a post-distribution monitoring reports. So if you could see that everything mentioned here was already mentioned and stated clearly during today's session. The previous slides has already clarified what it means. Hopefully this is more than enough. So in each project, you need to include a small paragraph like this, stating what kind of M&E activities you are going to implement, and try to avoid things related to PDMs or evaluations type of reports and activities. Thank you so much. So I think I covered all this part. I didn't talk about gender and gender mainstreaming the session, because monitoring and evaluation is like a paragraph that needs a dedicated session. So next week we will talk about gender and how to include it as part of writing proposals. But for this week assignment, I hope you could go to your account in Portal365 and then start writing the monitoring, evaluation, accountability, and learning paragraph. You could see this and you could include it and try to change every time, add from your learning. You could add, you could adapt, change, add, remove, delete, whatever thing you think that is needed during the implementation of the project. And thank you so much. I'll be available for your questions, and I'm happy that I didn't take more than 1 hour to talk about the session. So yes, please, if you have questions, I'll be happy to answer, and I will try to remove the mute. So now you are not mute. Anyone has a question will be very welcome. Also, you could include your questions on the chat bottom. I'm seeing now the participants, and all of you has all of you have really good history of implementing good projects, and so all of you are having the enough knowledge regarding project monitoring, evaluation, accountability, and learning.
Adil,
Yes.
I have a comment rather
Yes.
than question.
Yes.
I would really be happy if you could comment on remote monitoring and evaluation. You know, these days with the limited access to the field, sometimes you could not get like an security clearance, coronavirus, all this type of thing. There is really a high need for remote monitoring and evaluation. So it would be really nice if you just could elaborate more in this section.
Thank you, Faris. This is really important question. Yes, everything came to my mind. Yeah, we are going through a very unique situation. We had, like, no one has ever thought that the world will go through this crisis, which is like everyone is not able to travel, not everyone is is able to meet the people. You can't collect, like, bring people to talk to. So it's like very difficult to do field visits in all situations. Of course, you still can do it in many situations, but in general, it's not. applicable all time. So remote monitoring and evaluations is now a type is something NGOs and project managers, NEEL staff need to consider. So for example, and now you need to have new tools for collecting data. So for example, you need to design the M&D activity maybe in a different way. I will talk about, for example, accountability. Still, you need to do accountability like complaints and feedback mechanism. The complaints and feedback mechanisms could be complaints could be implemented through community committees. So it would be really good if you have a field volunteers from like if it would be really good to establish community committees that are linked to the project, so they are oriented about the project. And it would be good if they are elected by the beneficiaries themselves. So these people with men and women, they could be the best connectors, like the best like the best part of the complaints and feedback mechanism, because they are in the community. They could receive the complaints, and then they could send it to the project. So you could still collect the complaints by mobile. Maybe if there is a network or an internet, they could send the complaints by WhatsApp group, by Facebook group. They could have, like, if the NGO has a chat box on their websites, they could send their complaints to the chat box or chatbots. Um, um, that's just one part. And also like you need to send the feedback maybe by mobile if the beneficiary doesn't have a mobile number, especially if they are old people or young, or sometimes women, or don't have usually, like, the most vulnerable people don't have mobiles on rural and remote areas. So the community committees could receive the feedback also and reflect it to the beneficiaries. That's just like one idea. And in terms of monitoring, also it could be done by beneficiary. I mean, by volunteers, by community committees too. That's one thing. And now there is a new thing that, like, for example, there are platforms where beneficiaries could, like, for example, there could be a mobile application which has like the locations, for example, that has the health facilities, that could have like the schools. You could include them in the mobile apps, and then people could complain directly to the mobile, like to the mobile applications. For example, now NFDHR has the Education Watch, where all schools in Yemen are included in the Education Watch. So if there is a problem for a school, you could go directly, open the school page, and then you could talk about, like, the level of education in this school and so on. This is just like an example. There are many examples. I'm not sure, Faris, if you have an idea about different activities, because this is really a unique situation, and maybe you could have like an opinion about remote activities. Maybe someone else other than Faris could also comment on remote type of monitoring and evaluation and activities that could be done during crisis situations. Yes. Kubo Toolbox is also another way. Yes, I don't know how I forgot to talk about it, but also Kubo Toolbox is also the best tool used for remote collection of data, especially for reporting, like collecting data. Could be used for monitoring, but usually for surveys, final reviews, PDMs, and many evaluation activities. I would recommend monitoring and evaluation staff to learn how to use the Kubo toolbox and implement it, and then volunteers from the field could also learn how to use it and report any findings regarding the questionnaires and the data needs to be collected. So Kobo Toolbox is really important to be implemented in the field. I have a private message sent by Ahmed Al-Shami. He also mentioned that he developed Kobo Toolbox forms for remote monitoring and accountability activities. And it's filled regularly by the project teams in the field. And for for example, food distribution teams, they send like complaints and like at the level of distribution points. This is really important. Yes, this is really a good way to do a remote monitoring and evaluation and accountability by having technology such as Kobo Toolbox, which is very much known in the humanitarian settings and by humanitarian agencies. And Hayat mentioned that now some of the United agencies is doing they are doing remote call process to monitor projects. Yes, I didn't mention this during the session. Yes, exactly, Hayat. Usually the United Nations agencies or other donors sometimes whether they are doing themselves or they hire third party agencies, they implement call centers. So they collect, usually the NGO provide the donor or the third party agencies with the names of beneficiaries and their mobile numbers, and then they are calling them on regular basis. Sometimes it's like randomly, so they call and they listen to them talking about the type of assistance received. Is it okay? Did they receive exactly what was mentioned by the NGO? What was exactly budgeted for? What was exactly mentioned? So they usually collect this data and verify and make sure that the NGO is actually doing and implementing the project as stated in the proposal and as stated in the project agreement with the donor. So there are many, I'm sure all of you are in the field and all of you have implemented a great type and applicable type of remote M&E activities. Iman was asking about evaluation from external consultants. If the meal in NGO is separated from programs and works as third party in the NGO, can it take the role of the external consultants? Iman, although it could be, it takes actually the role of external consultants, but this is just in front of the NGO leadership and management. So it's like a type of verification of the implementation. It's like it's satisfying the NGO leadership and management. It gives them more credibility and more safety. They could feel safe that things are done in the right way if they receive like a separate report from the mail staff, but they are still internal because they are still from the same NGO. The donor will still ask for external consultants. But just to highlight this more, um, um, some activities are accepted by the NGOs to be done like internally. For example, post-distribution monitoring. Yes, it's called PDM monitoring. It's like monitoring, but it's an evaluation, and sometimes it's accepted to be done by the same NGO. And some donors, they are actually pushing the NGOs to do them themselves without hiring external consultants, because sometimes you need to conduct a lot of PDMs, and this needs a huge budget. So the donor push the NGO to do it themselves without hiring external consultants. It's usually difficult for M&E staff, but still it could be done by the same NGO staff. For the final evaluation of the projects, the final evaluation in blind surveys, sometimes we call them, usually it's usually uh, like the name it, or they call it final review of the project. For all final reviews or final evaluations of the project, usually it's done by the external consultants. It is usually done by external consultants, and usually the external consultants um, could be hired by the same NGO. So the budget of the external consultant could be part of the same budget of the project with the NGO, or it could be budgeted by the donor. So it could be hired by the donor themselves, not by the same NGO. But still, it's external, it's third party. So why we call it third party? It means that it's not the NGO, the implementing NGO, and it's not the funding agency. It's another party. Yes, as like if anyone has more questions, I'm happy for your questions. It clarified even more important points.
Adil, just a comment
Yes.
also. What I noticed during like preparing proposal, there is like always underestimation of the monitoring and evaluation in terms of budget. So
Yep.
is any standard or criteria, what is like the, let's say, reasonable percentage of monitoring and evaluation from the total budget? Sometimes we are using like 5%, 10% from the total budget. Is any like criteria or something that we can use to when we budgeting for the total proposal for monitoring and evaluation?
Although there is no, it's a really good question. Usually, there is no like clear criteria by most of the donors. They don't set a certain percentage. Some donors they set a percentage. For example, they might say, as you mentioned, 5 or 6%. If you need my advice, it's like you need to not add more than like 6%. 6% is usually a lot of budget, because, for example, if the project is $1 million project, then you are talking about $60,000. It's more than enough. So 6% is the best, maybe, or maybe 5 to 6% is the best budget, and it's maybe the maximum budget that I advise to include. And this is covering the monitoring and evaluation costs. Like, for example, if they need a car, they need a per diem costs, like daily costs for the M&E staff, or anyone who is going to do the field visits. It could be like the same budget could be spent for documenting like videos, documenting the humanitarian stories, sending external photographers to collect good photographs for the project, like especially the professional photographers. This is helping a lot. It could be part of this budget. Sending the media officer to collect humanitarian stories, success stories. So any field visits relating to collecting like beneficiary opinions, collecting complaints. Also about like for covering the final review, the midterm review, PDMs, any type of meal activity should be within this 6% or 5%. If lowered, it would be good, like 3%, 2%, 1%, but for sure, if, if you say like 1%, it might not be enough. So 3 to 6% is the best percentage to include within the project.
Hi, Dr. Adel. I want to ask a question.
Yes.
Is it necessary for the meal team to be in the field, not in the I mean all the year work time in the field? Is it necessary to be beside the coordinators in the field?
The best thing for them, the monitoring and evaluation staff, would be in the field for sure. But we usually cannot put everyone in the field, but like for example, when we put when we budget, like when we do the budget lines for project staff and then include M&E staff, we decide at that time, are we covering someone on the headquarter, or we need someone on the field? We need people in the field for sure, whether they are like M&E assistants, whether they are officers, or even M&E managers. If the project is really big in the field and for a long time, it would be really good to include field staff, field male officers. And usually we should not like put all the male staff in the headquarter, because usually the headquarter or the head office has a limited space for people to work in. So if you have like small office and still you need to hire people, you could hire them, but you state that the like the location of work is in the field. So the more the M&E staff are in the field, the best it is. So it is highly recommended that we put the staff or we hire staff to work on the field. Thank you so much, Hayat, for your question. Another question by Ahmad Ashami was if the PDM report is good to be done on monthly basis, or we could do it on a quarterly basis. So usually PDMs although some donors are insisting for doing them, but you need to make them as less as possible. You don't need to do them on monthly basis. So if let's say for food distribution done by WFP, because it's done on monthly basis, whether it's food distribution, voucher, cash assistance, or so on. So if it's done on monthly basis, you don't need to do it every month. You could do it every 2 months or quarterly. Quarterly is more than enough. You could even do it on every 6 months. Because it's a kind of verification method, but it would be really difficult to do like every month, especially if you are implementing food assistance in many food distribution points in many locations. It would be really difficult to collect PDMs every month. So it depends on the budget you have. It depends on the capacity you have of the staff. You need to decide, but it would be much better not to do it like every month, but maybe quarterly is much logic way to do it. Any more questions? Thank you so much, everyone, for your questions, for your comments. This is really helpful. I hope this is going to help us all. I learn also when I present this session, so we all learn together. Hopefully, we could continue the conversation in LinkedIn group, or also on Portal within our projects. Good luck, everyone. Have a nice evening, and talk to you next week. Bye-bye. Thank you.